So here we can see the traditional 4K scope, which has been used for years, if not decades, and is effective for the vast majority of arthroscopic procedures. But can we do more with less? And we can. We've advanced to the nanoscope, which is an even more minimally invasive approach to arthroscopy, less pain, faster recovery. But can we do even more? And here we're going to introduce the next evolution of minimally invasive arthroscopy with the NanoNeedlescope. As you can see here with the NanoNeedlescope, you can see that the handpiece is much different from the traditional scope and even much different from the traditional nanoscope. We can see that the handpiece has been designed to be ergonomic, and we'll demonstrate that in just a little bit. You can also see the size difference between the NanoNeedlescope as well as the traditional 4K arthroscope. And when you think about the ability to do things in tight spaces or to visualize from multiple different angles, the opportunities are essentially endless. The NanoNeedlescope is attached to a 1-meter cable that goes to a handpiece that you can see here that either you or your assistant or potentially the scrub nurse can use to capture video and capture the pictures so that we can document what we're doing and show the patients what we've done. When we talk about the NanoNeedlescope, we have to think, okay, how can we actually use this? How can we operationalize what we're using? Well, the ergonomics of the handpiece are incredible because you can really use fine motor skills to really hold on to the NanoNeedlescope and do what you need to do, and also use smaller sheaths and cannulas. With this generation of NanoNeedlescope, depending on the environment that you're in, you can really customize what you're doing. So depending on if you're in the clinic or the procedure room or in the operating room, you get your NanoNeedlescope delivered in this package that's sterilely packaged and ready for use. And then depending on what you're doing and the environment that you're in, you then can essentially pick what you need in an a la carte fashion. So essentially you could pick the sheaths that you might want, including low flow and high flow. And one new introduction to this generation of nanoarthroscopy is the low flow bent sheath, which was not previously available. So if for the clinic or procedure room where low flow is more ideal, this might be a perfect option to see around tight corners, potentially looking at the undersurface of the patella or the downslope of the trochlea, for example. And then certainly we have our straight and curved high flow sheaths that will allow us to do more, again, with a minimally invasive approach. With our working cannulas, you can see here we have the diamond pattern at the distal aspect of the cannula, which will help prevent slippage of this cannula from the portal and from the skin. This not only allows for introduction of our NanoNeedlescope, but also our instrumentation and our nanoresection portfolio. Also new in this generation of nanoneedle arthroscopy is our Percutaneous delivery system. This will allow us to use our cannulated sheath to precisely access the joint with minimal disruption to the surrounding skin, capsule, and soft tissue. So here we have a right knee, and just like traditional arthroscopy, we use our bony landmarks to guide where we will introduce our NanoNeedlescope. So here we can see the inferior border of the patella. I have not marked out, but we have the lateral border and medial border of the patella. And you can see here just mild skin marks in the area of the traditional anterolateral and anteromedial portal sites, where we will enter the joint and then work back and forth. Here we are using our 2.4 millimeter low flow rigid sheath or straight sheath to enter the joint. And this is perfect for in-office arthroscopy, procedure room arthroscopy, or when we are more looking to get a diagnosis more than anything else. This internal O-ring will allow me to securely latch the NanoNeedlescope onto the sheath, different from previous generations, and will allow me to avoid having any slippage of the NanoNeedlescope from the sheath. And you can hear and feel a snap as that O-ring connects to the NanoNeedlescope. Also new in this generation with the handpiece, super low profile and ergonomically designed so that you can be precise and controlled with your movements. As we can see here, the north end of the NanoNeedlescope is flat with ridges. So as I'm gripping the camera, I can feel with my thumb where I am and always know that north is up, because again, this is a 0-degree scope, different from our conventional arthroscopy. As we rotate, we can see on the opposite or south end of the NanoNeedlescope a fingerprint grip here that will always allow me to know where north is and where south is. Multiple grip positions to allow you to do what you need to do ergonomically and comfortably. In addition, I can now, because of the lightweight nature of this handpiece, move my hand all the way up to the knee, to the skin for fine controlled motor movements for super tight areas, particularly the back of the knee, posterior horn medial meniscus, and a very tight knee when we need to assess feel and look at the root, for example, or get around tight spaces. And we have flexibility within our NanoNeedlescope where we can actually bend if need be, but have fine motor control of the device into the knee joint. You can see that we have attached the stopcock to the sheath, which is included in the sheath kits. We've attached this directly to our sheath, and now we will attach our fluid source to the opposite end. So we're connected, and now we will turn on our fluid, and then we'll take a look inside the joint. After introducing the NanoNeedlescope into the joint, we can now see a phenomenal view intra-articularly. You can also see that I'm using the advantages of this generation of NanoNeedlescope to my advantage, in that I'm able to use the lightweight ergonomic design of the handpiece and actually not even hold the handpiece, but hold the scope much closer to the joint for additional precision and control. Here we can see, before I even establish a working portal, a great view of the knee joint. We can see the ACL right in front of me, the PCL here inserting up high into the notch. If I move my hand just slightly, minimal movements. This is super teeny tiny movements. We can see the lateral compartment perfectly, and I'm not even applying any sort of varus stress to the knee joint. We can see the lateral meniscus, the lateral tibial plateau, and the lateral femoral condyle. If I move the knee, we can then continue to do our diagnostic scope. Here I'm flexing the knee to run the condyle and really look at the posterior aspect of the lateral femoral condyle. And here I can slowly extend the knee and look at the anterior aspect of the lateral femoral condyle and then into the trochlea if we were going to go up into the patellofemoral joint. Here we can see anterior horn, lateral meniscus, and then we traverse to the medial side of the joint. And again, teeny tiny movements, and I'm able to easily enter the medial compartment, here visualizing medial meniscus, medial femoral condyle, medial tibial plateau. In an office brace procedure, I've essentially done all of this in less than 1 minute. And now, as I extend the knee and apply a subtle valgus force, I'm able to see posterior horn, medial meniscus. And you'll see there's a little fluid in here because I've not created a second portal, which I typically don't need to perform in the office for diagnostic purposes alone. We can see on this particular patient some chondral malacia over the posterior aspect of the medial tibial plateau, which would be helpful for diagnostic purposes. And we can follow the structure of the medial meniscus all the way down to the anterior horn. And now we're back into the notch. One of the other nice features of this generation is because of the design of the handpiece and the lightweight nature of the handpiece and where I can put my hand, I'm able to essentially go exactly where I want to go without the weight of the scope actually moving or vibrating or forcing me to jerk the piece around in any way, shape, or form. I'm seeing exactly what I want to see without any sort of vibration or subtle movement that gets me into a position where I can't see what I want to see. Here I'm literally going where I want to go and seeing what I want to see. From a diagnostic purpose alone, and I'll travel up into the patellofemoral joint, in the office, the utility of doing this is phenomenal. We're currently performing an ongoing study where we're assessing not only the effectiveness of the nanoscope for in-office arthroscopy for diagnostic purposes, but also the cost effectiveness compared to other diagnostic modalities, as well as safety and efficacy. So here we can see the trochlea. This patient does have a focal chondral defect, less than 2 millimeters of the superolateral aspect of the trochlea that we can see right there. And as I extend the knee, we're able to enter into the suprapatellar pouch. And I'll have my assistant help hold the knee nice and extended for me. And then I'm just going to change my hand as we're entering now a straight position as opposed to previously a flexed position of the knee. And we're into the suprapatellar pouch. I'm able to visualize synovitis on the medial side. In this patient, as in many of our patients, we can see a plica. And if I back up slowly and then rotate my handpiece, again, paying attention to the ergonomics of the handpiece, knowing what north is and knowing what south is, I can see the patella. And in this patient, similar to the trochlea, some fairly drastic chondromalacia, but more diffuse in nature in this patient's patella versus the trochlea. As we slowly flex the knee down, we'll come back into the notch. And in the office, this is really all I need to do. I don't need to establish any other portals. I certainly can in a minimally invasive approach and utilize, for example, the nano probe or nano instrumentation. But in an office where I'm going for a diagnosis more than anything else, I don't really need to do anything else. And I can withdraw the NanoNeedle scope with essentially no fluid distension in the knee, aspirate any remaining fluid, and the patient walks out of there happy with minimal to no pain and with a point of care diagnosis. So now what we'll do is introduce actually the percutaneous system to establish our working portal. So in the standard soft spot anteromedial portal location, I'll take our spinal needle, viewing with the NanoNeedle scope, and we can watch that spinal needle come in safely. We'll take off the inner stylet from the spinal needle, and then we will introduce our guide wire in a cannulated percutaneous fashion. And then we'll go ahead and remove the spinal needle while maintaining the guide wire in. And so we've now established our working portal under direct visualization using the NanoNeedle scope. Here I'm going to take out the guide wire and use the scalpel just to make a small nick in the skin to accommodate our cannula. And I'll actually use the trocar from the NanoNeedle scope to create a path before I put in the cannula, again, to keep everything safe and minimally invasive. So here I'm just essentially dilating this area of the capsule just a little bit with this obturator. And then we'll take our working portal, again, with the diamond coating here, which will ideally prevent this working cannula from coming out of the skin, allowing me to introduce it only a single time. From a safety and an infection perspective, going in and out of the skin less is more ideal for me. And you can see that diamond pattern right there arthroscopically. So here I'm going to hold on to the sheath and we will remove the obturator. So now we have our cannula and I can let go and essentially go hands-free. So now I have a variety of different options. I could switch the NanoNeedle scope to the anteromedial portal through this working cannula, or I could start doing a procedure, for example, probing or using a nano biter or using the Saber shaver. First, we will continue with our diagnostic scope and we'll go ahead and introduce the nanoprobe. Here with the nanoprobe, a couple of the features that I personally like. Number one, the calibration. So you can see the black marks here to measure how far you are along the shaft of the nanoprobe. And then we have the nanoprobe and the nitinol throw, essentially the tip of the nanoprobe. And here we can actually probe different structures. So here I'm petting the ACL. Beautiful. We can examine the PCL. We can look at the entirety of the notch. And then we can go into our compartments. So here you can see I'm using the nanoprobe to enter, in this case, the lateral compartment, and I can really assess the meniscus. And I really, due to the minimally invasive, low-profile nature of the NanoNeedle scope, I don't even have to apply, in many cases, varus or valgus forces to the knee to get into the compartments. That's one of the advantages, particularly in the office when you're under local anesthetic alone, where the actual intra-articular portion may not hurt, but applying a varus or valgus stress may cause the patient discomfort or even anxiety as you have to manipulate their knee. Due to the small nature of the NanoNeedle scope, I don't really have to do much manipulation, particularly in the office. So here I'm examining the entirety of the lateral meniscus. We can go over to the corner here and see the popliteal hiatus right in this region. And what a great view of the popliteus right there. Just phenomenal. Here we can go and examine the posterior horn lateral meniscus and then get into the lateral meniscus root. And essentially, I can be working right on top of myself and see the anatomy perfectly and not miss a thing. These are things that in tight knees, traditional arthroscopy just does not allow you to do, or does not allow you to do without causing some sort of iatrogenic damage to the cartilage or discomfort to the patient. And in an all-awake procedure in an office or procedure room, causing patient discomfort is a big negative. And so we want to avoid doing that at all costs. And again, I want to demonstrate the features of the cannula with that diamond coating. Here I'm going to remove my instrument, but you can see that the cannula stays in place, which is really quite nice. Next, through our working cannula, we're going to introduce one of the most exciting parts of this generation of nanoneedle arthroscopy, and this is our Nano Saber, a shaver that's going to allow me to do procedures in a minimally invasive fashion. I'm actually going to have my assistant hold that cannula so I don't shove that too far into the joint, and maybe pull back just a touch, and that's a really nice view of that diamond coating. And here now you can see we're going to be able to do some actual procedures right here, but in a minimally invasive approach. And then using, again, your preference of foot pedal or handpiece, you can go to work just like a traditional arthroscopy. So here I'm just debriding some of the infrapatellar fat pad so that we can improve our visualization just slightly. So here, and in my experience as part of our study, we've been able to do even this type of procedure all under local due to the fact that we're not causing significant pain with the procedure. We're not blowing up the joint with a ton of fluid. We're making super small incisions, and we've numbed up the capsule. When you numb up the capsule, which is typically the more painful part of arthroscopy, patients tend to do quite well and tolerate in procedure room or in operating room or even in office procedures where you would never be able to do that with traditional arthroscopy. For demonstration purposes, as you can see here, I've created a radial tear of the posterior body of the lateral meniscus. You can actually see little pieces of the meniscus here on the undersurface of the meniscus, and we will demonstrate how the Nano Saber shaver is able to effectively get those out, even with its low profile design. So what I'll do here is I'm going to insert the nanoprobe just to show again this meniscus tear. And we can see here by using the nitinol throw or tip, we can see that radial tear quite nicely. And this is a fairly common tear pattern that we might see. And again, we can see here on the undersurface little pieces of the meniscus. I'm going to withdraw the nanoprobe and then insert the nanobiter and show how I might resect more meniscus using the nanobiter. And here, again, for demonstration purposes, we'll actually enlarge in the tear just slightly. You can see the low profile nature of the nanobiter. And I'm able to get my hand, because of the low profile design of these instruments and of the NanoNeedlescope, all the way to the patient's body, having incredibly precise control. You can actually see how effective these biters are as well. Sharp, low profile, able to get into tight spaces. So we've done enough biting. So now we want to clean up the edges and use our Nano Saber shaver. And I'll introduce this here into the compartment. Look at that low profile design. It's essentially no bigger than the probe, and I'm able to get this into the tight spaces. You could not do this with a traditional shaver. You could not do this with a traditional shaver without applying a load to the joint to get into this space and not cause iatrogenic cartilage damage. And then again, either on foot pedal or handpiece, depending on your preference, we can start to go to work. And you can see by using the suction, those pieces of resected meniscus come up easily. The shaver does not get clogged, and I'm able to go trim and smooth out my meniscus border to get rid of the mechanical nature of this meniscus tear, leave as much healthy meniscus as I possibly can for patient function and satisfaction, and get a nice end result. Here you can see I'm done performing my lateral meniscectomy using the Nano Saber shaver. Nice smooth border, and then we'll go ahead and remove the shaver. And then we'll grab our probe. And by inserting the nanoprobe here, I can ensure that I've performed a complete resection of all of the intended tissue. And then I'm very happy with the work that I've done. I've left no large pieces of meniscus. And I could say we would all agree that that's a pretty satisfactory partial lateral meniscectomy, leaving and preserving as much healthy meniscus tissue as possible. And then with the biter, I'm able to really smooth out and trim up the edges to leave no fraying. Nice, sharp, smooth bites. And then we will introduce our Nano Saber shaver one final time to get up these debrided pieces of meniscus. And there's our completed partial lateral meniscectomy. And then here we can go and just get any remaining meniscus pieces out of the joint. Perfect, and you can see here, that was actually a very good example. I withdrew the shaver a little bit aggressively, and you can still see that the diamond coating prevented the cannula from coming out, even though I withdrew my instrument a little bit aggressively. For those of you who work with residents, fellows, assistants, who may not have as much experience with removing and inserting instruments as you do, that's a handy way of ensuring that you don't lose your portal. At this point, we have removed our NanoNeedle scope from our anterolateral portal, and we removed our working cannula with the diamond coating from the anteromedial portal. You can see here that these incisions are quite small, and particularly for pain control and cosmesis, I think very satisfactory to the patient. In the clinic, I would essentially close these with a steri-strip and a Band-Aid. In the procedure room or operating room, I may consider a subcutaneous dissolvable suture for a nice cosmetic result. Depending on the degree of procedure that we performed, less invasive would require less suturing. But if we were doing, for example, an ACL reconstruction using NanoNeedle arthroscopy or some sort of more invasive procedure still through minimally invasive portals, then I might consider a suture for any residual fluid. What you can see here is there's very minimal, if any, soft tissue distension from fluid because of the technology that needle arthroscopy and that, in particular, nanoneedle arthroscopy affords us. And we have much better satisfaction, much lower immediate postoperative pain, and ideally a better result, accomplishing everything we can accomplish with traditional arthroscopy, but through minimally invasive poke holes.